Tonight, Minnesota hospitals are sounding the alarm. A recent survey of 70 hospitals and health systems shows they lost hundreds of millions of dollars in the first half of this year. And the issue is only expected to get worse.
Danny Spiewak walks us through where all the money is going and what's being done to help hospitals. Danny?
Randy and Julie, 2 out of 3 hospitals included in this survey say they're losing money this year. Tonight, the Minnesota Hospital Association is calling on lawmakers to address the problem when they come back into session.
According to a survey of Minnesota Hospital Association members, facilities large and small across Minnesota have already lost more than $400 million this year. That's more than double what they lost in the same time period last year.
This is a pretty grave state, and I would say quite a crisis.
In the last 4 months alone, both Allina and Fairview have laid off hundreds of workers.
We're already seeing the damage.
Minnesota Hospital Association CEO Dr. Rahul Khurana says part of the problem is the growing number of patients on Medicare and Medicaid. Those federal programs offer fixed reimbursement rates to the hospitals.
So we can't raise prices. And these two programs, Medicaid and Medicare, are paying significantly below the cost of providing care to our patients.
The report also cites growing supply and labor costs.
You can't run a good business without spending the money on enough staff to take care of the patients properly.
Mary Turner heads the Minnesota Nurses Association, which fought for an 18% pay increase over 3 years in the most recent contract.
I would remind people that we haven't had anything near what the cost of living is for over a decade or so. And so a lot of that was making up for lost time.
Labor leaders and hospital executives have both expressed concerns about workforce shortages.
We need to really resource it in this upcoming session and for many sessions to come so that we can have the workers and the staff we need.
The financial picture is especially bleak for rural hospitals in Minnesota and nationwide. A study this year from the U of M found that roughly a quarter of unprofitable hospitals in rural areas have either closed or merged with other systems over the past decade.